In this video, I'm going to talk about osteoarthritis of the knee and whether or not you should carry on doing exercise, what sort of exercise you should do, and what you can expect if you've been told that you have this. Hello, I'm Steph and I'm one of the physios at online sports physio clinic, sportsinjuryphysio.com. Where you can get an online assessment and an individualised rehab plan for your injury. If you would like more details about this, then have a look at the description of this video and the link to the website is in there. Now, I'm going to first explain about osteoarthritis. We do need to make the point that it's very different to inflammatory arthritis such as rheumatoid arthritis, psoriatic arthritis, or even septic arthritis. They're very different. So in this video, we're talking about osteoarthritis, which is what people get referred to as wear and tear. So what is it? So if you imagine this is a bone and this is the other bone, so this is maybe your femur, this is your tibia, this is your knee joint. On the surface of your bone, and people who eat meat will know this from, when they've eaten meat with bones and things. At the end of a bone, you've got the shiny cartilage that protects the bone ends. The bone ends have very high lots of nerve endings, so they're very highly innervated, which means they're sensitive to pain, and they're covered then in the shiny cartilage that is less sensitive to pain. So when you're weight bearing on that cartilage on each bone end. If you have an x-ray, so typically someone might have knee pain, they go to the GP sends them for an x-ray, the x-ray comes back saying that they have mild degenerative changes or mild arthritic changes. They might then go into a panic thinking, oh my God, I've got arthritis, what should I do? I need to stop running. So this is what that means. When you have an x-ray, it only shows bone. So they know how much cartilage you've got by how much gap there is, because the cartilage won't show on an x-ray. If you've got a nice big gap, that means you've got lots of cartilage and you've got a happy, healthy joint. If your gap is thinner, then they know that the cartilage must be thinner, and they will grade that as either mild to moderate osteoarthritis. If you've got very, very end stage arthritis, that's what they call bone on bone, and you've got no gap at all. That's the sort of thing that needs a knee replacement. But most people over the age of 30, 40 years old will have a little bit of thinning, because it is a normal wear and tear aging thing. So just like our hair will go a bit grey, our skin will go a bit wrinkly, our joint space will get a bit thinner, the cartilage will get a bit thinner. And had you not had knee pain, you might never have noticed. So 60 to 80% of people who have radiological, so on an x-ray, mild to moderate knee OA, will not have symptoms that correlate with that. So you might have a lot of people who, if you x-rayed them, would have mild to moderate OA, but would have no knee pain at all. And that's because there are so many other things that cause pain in your knee, other than wear and tear. So you might have a problem with your biomechanics around your patella. You might have a problem with the tendon from your patella or your quads tendon. You might have fat pads impingement. There's all sorts of things that can give you pain in the absence of trauma that aren't arthritis. So that's where it's always worth getting a proper assessment from someone who knows about biomechanics and things, so that they can work you through it and give you the right things to do. Now, the next thing to note is that in arthritis, the way it's treated these days is actually mostly about education advice to know about your condition and what it means and what to do about it. Exercise, and I'll talk through this a bit more in a moment, so the right kind of exercise, which is really important, and weight management. Now, those are the three core things that are advised by the National Institute of Clinical and Health Excellence, or NICE as it's known, which looks at all the evidence that's available in the research currently, and then produces national guidelines on what to do about it. It's really interesting to know that medication, keyhole surgery and injections are not considered core interventions for mild to moderate knee osteoarthritis. In terms of exercise, it's not just a case of doing loads of squats and step-ups and getting stronger and doing lots of that sort of stuff, which is what you'll see on some websites that give advice for people with arthritis. Because if it's already hurting when you're doing squats and walking up the stairs, well, it's going to hurt a lot more if you do more squats and walk up more stairs. So it's really important that you have someone look at what you're able to do currently, what you would like to do, and then make you a plan that fits that doesn't irritate the knee, but does get things stronger. So it might be about improving the muscles around your core and your glutes, and actually allowing the knee some time to rest and settle down while you work on some of the other stuff. And actually doing that provides you a better base and better movement control, so the knee settles down, and then actually you can build the knee strength up later once it's settled down from its acute flare up, and you have better success that way. So it's also not a case of keeping going with what you're doing and trying to push through the pain, because actually, again, if your knee is hurting when you're walking a short distance, well, it's not going to appreciate it if you decide to go for a mile walk every day to try and get it better. So it might be a case of stepping back and doing less for a short while in order to allow it to settle, and then building things back up slowly. But this is all the sort of things that we do. We have a look at everything that you do in a day or a week, unpick it, see what is aggravating it, see what you should be doing, what you can still do, and then what you can do to try and help things get better in the future. So there we go. In a nutshell, that's a little bit about knee OA. It doesn't mean that you have to stop doing all the things you love. It just means that you need to modify for a short period of time what you're doing in order to allow it to settle, and then you need a clear plan of how to get yourself back to doing all the things you enjoy. I hope you found this useful, and again, if you have any queries, then please do contact us or visit our website for more information. Okay, bye.